Hello, my name is Kirsty McKay and I work as a Macmillan Oncology nurse practitioner in Laurel House. I work along with the oncologists, assessing patients for chemotherapy and prescribing their treatment, and many of you will meet me on your chemotherapy journey. In this video, I'll explain a little bit more about chemotherapy and what to expect when you attend for a chemotherapy appointment. When you come for your first appointment with the oncologist, your clinical nurse specialist may also be present, and you may have a partner or a friend with you for the consultation. Depending on how busy the clinic is, your partner may have to wait in the car until you are called. During this visit, the consultant will talk about treatment suitable for you. A course of treatment can take a number of months to complete. This may be 3, 4, or 6 months, depending on your treatment regime. Before starting your treatment, you may hear these terms used. Neoadjuvant. And what this means is that you will be given chemotherapy or a mix of chemotherapy and radiotherapy to shrink your tumour before surgery. Adjuvant. This is chemotherapy given after surgery. Your surgery has taken away your tumour and chemotherapy is given with the intention of cure. Or palliative. This is treatment that will control your cancer but won't cure. Following this discussion, you'll be given some written information on the treatment to take home and read. You'll be given an appointment to come back to start treatment. So, what is chemotherapy? It is a drug treatment that works by interfering with cell division. The drugs get into your bloodstream and attack the cancer cells wherever they are and stop them from dividing and multiplying. The chemotherapy drugs are given either by IV infusion or as a tablet, or it could be a combination of both. With tablet chemotherapy, you will collect your medication in Laurel House and then take the tablets at home, usually for 7 to 14 days. Remember, taking chemotherapy tablets does not mean you're getting a less strong or less effective treatment. It means that this is the most appropriate drug for you and your type and stage of cancer. For the IV treatments, you will have a cannula, a small plastic tube inserted into your vein before your treatment, and this will be attached to a drip, and your drugs will be given through the drip. The drip can take a few minutes or a few hours, and the cannula will be removed after your infusion is complete. Some patients will have a drip in the chemotherapy unit over 3 to 4 hours, and then will go home with an infuser pump or bottle containing chemo for 48 hours. If you're having this sort of treatment, you will have a special IV line called a PICC line inserted before your first chemotherapy, and this will stay in for the duration of your chemotherapy treatment. Your bloods can be taken from this line, and any medications needed while you're having your chemotherapy, such as anti-sickness drugs, can also be given through the line. Your infuser pump, or bottle, which looks like a baby's bottle, is connected to the end of the PICC line, and the drugs infuse over 48 hours. After the 48 hours, a district nurse will come to your home and disconnect the pump. The district nurse will call weekly to dress your PICC line and take any blood samples required before your next treatment. There are a few things you should try and do prior to starting treatment. If possible, see your dentist and ensure any dental work is done before treatment. Skin care. Look after your skin. For example, drink plenty of fluids and use a good moisturiser regularly. Try and keep active, eat well, and make sure your flu vaccines are up to date, especially when coming into the winter. Each chemotherapy treatment is called a cycle, and normally your doctor will tell you at your first appointment how many cycles are planned. A cycle of chemotherapy is the time between one round of treatment until the start of the next. Depending on your treatment, the cycle could be 7, 14, 21 or 28 days. When you come for your first chemotherapy treatment, you will normally have had your bloods taken the day before. This may have been in your local hospital outpatients department or at your GP surgery. You will have an ECG or a heart trace done, and you will have your height and weight recorded, which is important to work out the dose of your treatment. Your weight will be checked at every visit. The doctor will go over the treatment plan again with you and answer any questions you have, and you will then be asked to sign a consent form. There are refreshments available in Laurel House for patients, and lunch will be provided. Prepare on your first day of treatment to be there for most of the day. Arrange for someone to bring you to your appointment, as you should not drive on the first day of treatment. Please check with your healthcare team if you're allowed to bring somebody in with you while you're having your treatment. Wear comfortable clothing. We encourage you to wear something with short sleeves, which will make it easier to access your IV line, but bring a cardigan or sweatshirt just in case you get cold. During the winter months, bring a scarf, hat and gloves for travelling home after treatment. Bring something to help you pass the time, such as a book, newspaper, mobile device, as there is free Wi-Fi, or even your knitting. You can also bring some snacks or sweets with you. Please make sure not to bring anything that contains nuts. With any treatment, there's always the possibility of some side effects. At your first appointment, you will be given an information leaflet outlining your chemotherapy treatment and the possible side effects. I'll mention the most common ones. Fatigue or tiredness. Many people feel more tired when they are on treatment, especially as treatment progresses. Infection. Chemotherapy can affect your immune system, which means you may be more prone to an infection. It is important to be aware of what to look out for and to report it so it can be treated appropriately. Nausea. Some people may experience this, but you'll be given medication to help manage this. Some non-medical things that people have found useful are ginger products like ginger nuts, ginger and lemon tea, or you could try sea bands which you wear on your wrists. Diarrhea. You will be given anti-diarrheal medication to take home after your first treatment, and nursing and pharmacy staff will explain how to use this. Peripheral neuropathy. Some people may experience pins and needles in their fingers and or toes. Sometimes this is made worse by the cold for the first few days after treatment. The staff will explain how to avoid or minimise this. Skin changes. You may find your skin will be drier. Some people may develop skin rashes. It's important to take good care of your skin and to moisturise regularly and drink plenty of water. You may see other professionals during your visit, for example, a dietitian, physio, clinical nurse specialist or pharmacist. You'll be given the helpline number if you're feeling unwell. The nurse will provide you with information about what to specifically look out for to prompt you calling the helpline. Our helpline operates Monday to Friday from 8:30 to 4:30 and is based in Laurel House. It's a dedicated service for all of our oncology and haematology patients, so if you contact the helpline, you will get specialised cancer advice from a chemotherapy nurse. This service is also supported out of hours by the nursing staff in Ward C7 in Antrim Hospital. The nurses that operate this helpline must complete a full assessment to determine why you might be feeling unwell. If you need advice any time, day or night, they will be able to support you, as they can access urgent information from the medical team, either in Antrim or in the oncology team in Belfast. So please remember, if you're feeling unwell, contact the chemotherapy helpline first. For more information about what to expect when visiting Laurel House, please make sure to watch the walkthrough video, which will be included below. For any other queries, please contact the Macmillan Information and Support Service. Contact details will be provided at the end of this video. Thank you for watching.